Good morning. It's time, and let's start it on the meeting. This is a special meeting of the panel on welfare services to deal with the review of disability allowance and the system for processing applications. I'd like to thank the deputations for being here. Let's invite the administration in. Some deputations have attended open hearings before, but I'd like to remind you that the special hearing will last till 11:30. We have 35 deputations here with us today. If deputations or individuals require headsets, Channel 0 is the floor, Channel 1 Cantonese, Channel 2 English, Channel 3 Putonghua. I will invite you to speak according to the order on the seating plan. I'd like to remind you that your speeches will not be protected by Legislative Powers and Privileges Ordinance Cap 382 and the relevant protections. Your written submissions would also not be protected. Please pay attention to the notice to members of the public attending meetings in the Legislative conference rooms or galleries. Please take note of the relevant security measures. If you have submissions for us, please hand them to our staff, or you can submit them afterwards. They will be circulated later. Once again, let's welcome the administration. Today, we have the Labor and Welfare Bureau, Social Welfare Department, and the Hospital Authority. Thank you very much. We are looking at the same paper as the last meeting, so perhaps we wouldn't need any briefing. Or would the Deputy Secretary have anything to say? I will spend a few minutes to update members. Please. In the Chief Executive's manifesto last year, he announced completion of the review of the Disability Allowance, and 9 recommendations were put forward, and 8 have been implemented, and the remaining is the review on the medical assessment form. At around this time last year, we met deputations and certain persons with disabilities, and we understood their concerns towards the review of the MAF. That's why the government suspended the review of the form, so we are still using the same form. The form would probably be the focus of the discussion for today. The PWDs and deputations agreed with the removal of the reference to 100% loss of earning capacity. But they feel that the option or the assessment of work in the original occupation and perform any other kind of work for which she is suited should be retained, and the categories of disability should also be retained. As to removal of the reference to a 100% loss of earning capacity, the government agrees with the removal. Currently, DA is based on severe disability. If someone is assessed as severely disabled and requires constant attendance, that person should be eligible for DA whether or not he or she is engaged in paid work. And we should not consider whether there's 100% loss of earning capacity for the applicant. So we would like to clarify this point. so that doctors can carry out assessments more effectively. When removing the reference to 100% loss of earning capacity, we should also remove the work-related condition or criterion to assess whether a person can still work in the original occupation or any other occupations is technically challenging. And the working group feels that removing such condition would not affect the eligibility of applicants. And this criterion still exists, and we have not made any amendments. And under 1B on the categories of disability, we have no intention to tighten the eligibility or application criteria. But according to the review of the checklist, if the disability does not fall under the 7 items under the schedule, the applicant must receive an assessment to see whether he or she would need support of others before carrying out the tasks. And we understand concerns, and we are afraid that removing such criterion would affect the eligibility. And we might reinstate such categories into the schedule, and we would study this with the public medical officers of the HA. So that's all from me for now, and I'd like to stress that our amendments serve to clarify certain matters, and we have no intention to tighten the criteria. Thank you very much. Now let's enter the open hearing proper. First, Ms. Choi Yok-mui. We are from the Disability Youth Alliance, and we have a few requests towards the Disability Allowance. We request the removal of the reference to 100% loss of earning capacity, and in the medical assessment form, or MAF, we should retain the criterion of work in the original occupation and perform any other kind of work for which he or she is suited. If we remove this criterion, some DA recipients might no longer be granted DA. We also request the retention of category B in the MAF, or else some DA recipients might lose their eligibility. We should also refine the appeal mechanism. Right now, appeals take a very long time. The government should establish a service pledge as soon as possible and draw up reasonable timeframes for processing appeals. A lot of PWDs suffer loss of one limb or mild disability. The SWD should consider introducing lower DA for people with relatively mild disability, but they still face a lot of unfair treatment and inconvenience in life. Finally, we hope the government can set up an assessment group. Assessment should not just be done by doctors, and the government should set up an assessment group including therapists and social workers, and they can assess the impacts of disability on the lives of PWD in granting DA. Finally, we hope the SWD would unify the reimbursement of transport subsidy, and DA recipients under 12 or above 65 should receive the same levels of payment. Thank you. From the self-help organization, Ms. Ma. Thank you, Chairman. Good morning. I represent the Wheelchair Self-Help Alliance. My name is Ma. I have 2 points to make with regards to the MAF. First of all, the distinguishment between normal DA and higher DA is really blurred. I want to cite a few examples. And it's hard for doctors to ascertain a person as needing constant care. It's very hard to define, and as such, we have a number of issues. For a family of 2 PWDs, if they have similar health conditions, if one is on normal DA and another is on higher DA, I think this is really unfair. One of my friends is receiving higher DA, and after a visit to the doctor ticked normal DA for my friend, even though my friend's health conditions did not improve. So why was that the case? And the SWD or doctor did not provide any explanation. This is really problematic. Finally, about myself. I'm half a victim as well. Since I was small, I've been receiving normal DA. But I require constant care. And at nighttime, I receive constant care from my parents. But why am I not eligible for higher DA? But the doctor looked at me, and I do not look like that. I need a lot of care. No one knows that I require care at night, and they do not know how much care I need. So this assessment mechanism carried out by doctors is really problematic. So I want to point out that we cannot just rely on doctors in assessments. I suggest we refer to the ICF drawn up by the World Health Organization in 2001, but I don't know why Hong Kong still has no ordinance to assess the level of disability for PWDs. Thank you very much. You said doctors did not think that you look disabled and you look like you seem to require constant care. Did the doctor actually tell you this? I went back for medical checks, and the doctor would not know. So does it mean you didn't have time to talk to the doctor? Right, because our meetings were very short and the doctor would not have time. Perhaps we would ask the hospital authority to address that later. For the watching audience, ICF refers to International Classification of Functioning Disability and Health, which is an international standard to assess health conditions from the self-help organization. Ms. Ng, thank you. I want to follow up on what Ms. Ma has said. The system is really problematic. It hinges on doctors. if we are talking about the primary doctor of an applicant, they would know the lifestyle and conditions of the patient. But the situation is very often during repeat visits, a different doctor might be in charge. And the doctor would only look up the computer system to assess or check the level of disability. But for conditions such as whether the patients require care, the doctors cannot possibly tell from the computer system. So right now, a single person would decide whether the applicant can receive normal or higher DA. Right now, the appeals period is also problematic, and appeals often take 12 months. But as you know, DA is pegged to different payments, including the $2 transport concessionary scheme and the community care fund. And some of my friends rely on the $1,000 of DA because they are not eligible to CSSA. We want to apply for living subsidy under the CCF for them so that they can receive another $2,000 per month, but only higher DA applicants are eligible. So while they're waiting, they cannot even apply for the CCF, and they cannot enjoy the $2 transport scheme. And we have to remove the reference to 100% loss of earning capacity. Our chairman said the disability allowance was already granted in 1973. We did not have low platform buses. We had no rehab buses. But you still granted them the DA. So now you still have such reference to 100% loss of earning capacity. This is incredible. Of course, the government would encourage people to work. For people admitted to the hospital for more than 60 days, and the higher DA would be scrapped. Why would there be such a mechanism of penalizing the applicant? People admitted to hospital would have the higher DA scrapped. Is this a case of double benefits? Would hospitalization be a form of benefit? I don't really understand the logic. Perhaps the government can consider removing this criterion.
Well, at first we were thinking that we would be talking about MAF, but the deputations have reminded us that there are many other concerns. So maybe we should listen to the response from the administration later. Next, Mr. Chiu Ho Lam is from the concern group for PWDs. As for our concern group and other associations, we have talked to the LWB and SWD. We have held many meetings. However, the LWB and SWD tend to be very forgetful. They always say that, well, it's the first time we hear about this. Actually, we have been fighting for our causes for a long time. We hope that for PWDs and chronic disease patients, they should all be enjoying DA. But the government officials have been saying no. For chronic disease patients, they always have to go to medical consultations. They have to buy a lot of equipment, and they cannot receive any allowance or subsidies. So how are we supposed to be able to afford that? Well, lately, a patient suffering from a rare disease passed away, and they didn't enjoy DA as well. And doctors would say that even if you suffer from cancer, you cannot get DA. So for PWDs, it's very difficult for them to find jobs. The government still refuses to give DA to many of them. So for chronic patients and PWDs, they should both enjoy DA. Well, what is the government spending money on? Billions of dollars are spent for white elephant projects. It's like dumping money into the sea. So why don't you grant such resources to PWDs and chronic patients? You should be more caring. You have always been saying that you cared about us, but it's just empty words. So I hope that the government would remove the reference to 100% loss of earning capacity. And also, I object to the deletion of Part B, because it would affect mental patients and mentally retarded people. And also the assessment criterion of working in the original occupation and performing any other kind of work for which he or she is suited should be retained. But the government has turned a deaf ear to us. Now for the present DA, the amount is not sufficient for us. I hope that it can be increased to $2,500 per month. And each year there should be an increase. At least it should be able to be in line with the inflation rate so that we can buy our essential equipment or services. Otherwise, how are we supposed to use such services? And I hope that the SWD can give us healthcare coupons. Not only elderly people need them, PWDs also need them. This is not the first time I hear from you, so I hope that the government officials won't say so. Next, Madam Lau Kam Fong. Good morning, Chairman and government officials. My son suffers from a serious illness. He's in his 30s. He has got this illness ever since he was born, but he cannot enjoy DA now. In the past, he was able to enjoy DA. So for my son, he has to have a blood transfusion every 3 weeks, and every night he has to have an injection. If not, his internal organs would be affected, and it may even lead to death. And this is the injection machine or equipment. Its price is more than $8,000, $8,500. And I also need to buy medicine, and you need to dilute this powder and then put it in the syringe for injection. And every night it has to be linked to the equipment for 8 to 10 hours. Now you should try doing it on your bed. Something's linked to you for 8 to 10 hours every night. And when my son was a kid, if he moved at night, the injection hole would become swollen. So if you are attached to this equipment, of course you cannot go out at night. You will not feel happy at all for this kind of life. You should try to do it yourself, having this injection for 8 to 10 hours per night. What will you feel? And also we need to use a lot of medical consumables. And also this equipment has to be maintained. You just pay for it for once. You have to maintain it. And it costs about $500 per month. If you need to buy parts, you have to spend more. If the motor is broken, you have to repair it. It's more than, it's like several $1,000s. You may even have to buy a new one. And also, you may suffer from other problems after taking the medicine. Your bones will be affected. They will become fragile or even deformed. You may lose your teeth. So their daily lives are are hugely affected. It's not only my son. There are over 400 people suffering from this. Only 100 of them get DA. And in recent years, my son has not been able to get DA. So we really need some subsidies. So for the standard DA, is only $1,000+. It's not sufficient. Many people say that it should be increased to more than $2,000. I really don't understand why it is like this. And I have asked my son's doctor. He says that for the MAF, he cannot take a category which is suitable for my son. Well, in the past, my son was able to get DA, but now he cannot. I don't understand why. You have to teach me how to apply for DA now. My son has a disability certificate, but he cannot get the DA. So I really don't know what the government's policies are. The certificate is not linked to the DA. I really don't understand. Earlier on, like Chiu said, and also like what other deputations have said, we hope that the reference of 100% loss of earning capacity can be removed. And working in the original occupation and performing any other kind of work for which she is suited should be retained. And we also hope that Part B should be maintained. For PWDs and chronic patients, I think both external and internal equipment should also be subsidized. It's really a hard life for the patients. I'm sorry about that. You don't need to say sorry. I think the government should say sorry to you. Ms. Lau, you said that your son was on DA. So when did the government stop giving it to him? So how many years? More than 3 years. Thank you. Perhaps later we'll ask the government to give you an answer. Officials have been talking to me. They say that they are following up, but I haven't heard from them. They constantly ask me to go for an assessment. Next, Mr. Ko Chong. I want to make 2 points. For the amendment to MAF, I'm not satisfied. Now you are deleting 100% loss of earning capacity. Now for people with mental retardation, most of them have to do manual labor work, and some of them are working in sheltered workshop. So it's quite impossible for them to find a job in the open market. Last year, we also talked about this. The government just turned a deaf ear to us. The government says that it won't be amending the laws. Ms. Tam has talked about this several times. And for the MAF, now you are making amendments. For example, 100% loss of earning capacity, someone who needs substantial help from others to cope with daily life, etc. But you are making but if you make such amendments, they are quite unfair to us. And let me talk about the assessment system. Last year, when I was assessed, the SWD said that, well, you will have to renew your application in 40 days. So I waited, and when my DA almost expired, SWD took me down the garden path. He asked me to go to a clinical psychologist for assessments. It took a month, and then I was sent back to a psychiatrist. So for 2 months, I didn't get DA. Fortunately, I had a job, but for those who don't have a job, if they do not have DA for 2 months, it will have a huge impact on their daily life. So it took 2 months for me to wait for the DA. So what can you do without money for 2 months? Why can't the government make arrangements earlier so that the DA can be renewed in time? So I hope that the government can really advance its work so that our assessments can be made in time. Don't do it after the deadline, otherwise serious problems will arise. Next, Mr. Chen Kun. Chairman. Professor Fernando Zhang and other people have been talking about this for a long time. I think for documents that were issued 20 years ago now, they still hold water. So I really don't know what to say now. As for my remaining time, I will stand in silence. I hope we can have some other government officials like Mrs. Elizabeth Wong. I really missed her. We are PWDs. We will eventually pass away. I hope to see more Mrs. Elizabeth Wong, whom we would miss. May I ask you a question? Why do you want government officials to be like Mrs. Elizabeth Wong? Why do you miss her? I read an interview. Mrs. Wong has done a lot. She put together many innovative programs. Her husband is now handicapped, and she herself is losing many of her capacities. And now she and her husband are enjoying the policy she made in the past. So I hope that the government officials will listen to me. I really don't have anything to say. I will stand in silence for the remainder of my speech time.
All right. We got your message, even though you only stood in silence. So we have all got the message. Ms. Wang Qian. Thank you. This is the second year I'm attending an open hearing. A lot have happened over the last 2 years. We want to amend the form, and some higher DA recipients are now receiving normal DA, and I don't know why there's no money for chronic patients and PWDs like us. First of all, you might not see me again a few years later because I'm suffering from a disease. And you might find my condition not very serious because I still have my limbs. I am out of work right now, but are you giving me the resources for me to receive benefits, I fail to receive a lot of things. For example, a disability pass, I cannot enjoy $2 concessionary fares. A lot of people ask why I'm not enjoying the concessionary fare. I'm receiving 50% of CSSA. Even when I lose my legs, I might not be able to receive higher DA. If you really care about PWDs and chronic patients, stop talking about welfare offsetting. And you are trying to link different forms of subsidy, and at the end we get nothing. And PWDs require lifelong help, and chronic patients are also suffering. Why are you linking these different benefits or welfare initiatives, especially for CSSA recipients? Do you think we really want to receive that money? Do you think we have a choice? Can you give us healthcare vouchers for chronic patients? You only take care of those above 65. What about people like us? You said you care about people above 65. I don't see how you really care about the elderly. You only come up with RCHE ordinance or carer schemes. You're not really helping them. I'm living in a residential care home for the elderly. I'm living in the 4th home already. I'm only 28. Wake up. Thank you. I think we are all awake, especially except those who pretend to be asleep. Mr. Ng Xiulun, thank you. I'm from the Hong Kong Rehab Society, and around this time last year, we attended an open hearing to talk about the MAF. A year on, some important points we made have not been adopted by the government, and we need to speak once more. These points include: we agree that the we agree with the removal of the reference to 100% loss of earning capacity, and this is indisputable. We have said that in the open hearing 1 year ago, and today there is still this reference in the MAF. I don't know why this is the case, but I hope that the government can remove this reference as soon as possible. And as Mr. Donald Chan said, work in the criterion of work in the original occupation and perform any other kind of work for which he or she is suited, the government intends to remove this criterion. Some people might have lost working ability and they cannot perform their original work. And based on this criterion, they can receive DA. The government said they have no intention to tighten the eligibility for DA, and we want to believe that. But if we are to remove this criterion, some people cannot receive DA anymore. So I hope the government would be generous in and retain this criterion. As to Part 1B of the MAF, doctors are very busy and they can only spare a few minutes or 5 minutes in assessing a patient and reviewing the DA condition. If we provide some boxes for doctors to take on the form, can we alleviate the doctor's workload? And if we have some pre-listed criteria for certain diseases, then we can make life easier for the doctors. I don't see how removing Part 1B of the MAF would improve the form, so we suggest retaining Part 1B. And some deputations talked about the ICF. And this is a healthcare and social assessment model. And the assessment should include occupational therapists and social workers, so we can alleviate the burden on doctors. And we can come up with more complete assessments of PWDs and their social needs in determining their DA eligibility. From the Civic Party, Ms. Chow Yun-man. I represent the Civic Party. I'd like to first talk about the MAF. First of all, the reference to 100% loss of earning capacity, many deputations have said that it must be removed. But because the term 100% is very subjective to the standards of different doctors, so we should first remove this reference. Secondly, for the criterion, work in the original occupation or any other kind of work. And there are different criteria, for example, self-expression, the ability to stand up. We had a muscular atrophy patient and a thalassemia patient. And some of these patients cannot resume their original work, and the allowance can pay for their medical costs. And I also suggest retaining the types of disability under Part 1B. Some doctors would only spend a few minutes on the patients. That's why we should retain these conditions in order to safeguard the interests of the patients. We realize that the government wants to take care of PWDs, so hopefully we can refine the system as soon as possible. Our PWDs have no choice. They don't choose to have those diseases. And none of the people here would want to be disabled. But unfortunately, medical costs are extremely high. And since your idea is to subsidize their medical costs, why are you setting so many barriers and forms for them? A deputation said the syringes cost more than $8,000, and the the normal DA is only $1,600. Why are you still taking that away from them? They are not asking for more benefits, but only very basic dignity. Thank you very much. I think a lot of people would echo with you, especially after we passed the 5.4 billion Disneyland expansion project last week. Ms. Fu from the Park Team Concern Group. Since time is limited, I'd like to highlight 2 points. First of all, we feel that recipients of Social Security Allowance scheme and transport allowance should also receive DA because these allowances are different in nature. DA addresses the special needs of PWDs, and CSSA helps with the helps meet the basic living needs of applicants. Special needs are not the same as basic needs. And to avoid redundant benefits for applicants, the government has sought to prevent that, and the government has hefty reserves. They would only have to spend a few dozen $billion to sustain such assistance. Why are they being so mean? the government doesn't want people to receive double benefits, but can we choose not to pay double taxes? If we pay tobacco taxes or airport departure tax, can we choose not to pay our salaries tax? You should spend the taxes received on people in need. DA recipients can also receive $2 concessionary fares, just like elderly people. And mentally handicapped PWDs should also benefit. They might look the same as ordinary people, but when they use the octopus card, and there would be a special beep, and this beep would has a labeling effect on them. They look physically able, and some people might misunderstand them, that they are trying to exploit the system, and other people might discriminate against them. And a recipient age about 30 was inspected by an MTR staff member, and the MTR staff looked at him with in a very strange attitude, and the recipient was angry. And sometimes these a strange stare is very discriminating to the recipients. And would the government increase the subsidy from $270 to about $600? Thank you very much. If there's a beep, then people would know that they are using a concession, and if they are not elderly people or children, then people might deduct that they are mentally disabled. Mr. Tam from the Mildly Handicapped Concern Group. I'm mildly mentally handicapped, and I'm also autistic. I hope the government would use the MAF and the latest guidelines in gauging whether I'm eligible for DA. Mental disability is permanent and it cannot be cured. Some mentally handicapped persons would undergo a renewal every 3 years. This is a waste of public resources and time. Some mildly mentally handicapped applicants have to work, and when they visit the doctor, the doctors might deem them ineligible because they look smart. We agree with the removal of reference to 100% loss of earning capacity, but we are against removing the conditions under Part 1B of MAF and the work criterion of work in the original occupation and perform any other kind of work. The mentally handicapped can receive education and training in acquiring living skills.
We are afraid that if the MAF is revised like this, there may be further problems in the future, because people with mental handicap may be misjudged by doctors if they look smart. According to the WHO's definitions, there are many elements to be considered under mental retardation, and the government are not following these guidelines strictly. So for mentally retarded patients, I think they should be included in Part 1B, and also working in the original occupation criterion should also be retained. And you have to look at the severity of different mental retardations, so that mentally retarded people's daily life problems can be resolved. Now, I will end my speech here. So I would like to ask the government officials, if you look at my condition now, do you think I'm eligible for DA? If your answer is no, it would mean that the DA system so remains in the 70s. You are just looking at DA from the perspective of industrial injury, and it is not a comprehensive system for protecting PWDs. The government should not ignore our needs. You should improve the DA system immediately so that an accommodating and inclusive society can be built. Next, Ms. Chintana Siso. Well, just now the government says that it has no intention to tighten the existing eligibility criteria for the DA. However, there are a lot of problems concerning the MAF, and the requirements are harsh. Now we have the following requests. First, immediately remove the reference to 100% loss of earning capacity, and we object to the deletion of the assessment criterion of working in the original occupation and performing any other kind of work. And we object to the deletion of the types of disabilities in Part 1B. And when an assessment is made, the list for rehabilitative equipments should be broadened, including wheelchair. And also, you should make reference to the IFC framework. For example, you should look at the applicants' limitations in terms of their social participation, etc. And under the present system, you cannot just rely on doctors. An assessment working group should be set up, and different professionals should be included in the working group. And also the DA rate should be increased, and a third tier of special DA should be set up, because there are patients who may need huge amounts of healthcare equipment and services. And also when it comes to rare diseases, and for certain diseases, they are not curable, so you should not include regular review in the system. And also some applicants may be receiving a lower rate of DA now instead of the past higher rates of DA, and then they cannot enjoy the CCF. So this should also be reviewed. And then after today's hearing, is there any kind of platform we can follow up on these issues? Now, for the 10 points you mentioned just now, are they written in a deputation? Yes, that has been submitted to you. Thank you. Well, maybe later on the hospital authority can give us a reply. For people with mental disability, why do you have to review them all the time? Does it mean that after 3 years they will no longer be mentally handicapped? Ms. Lam Chan. Good morning, Chairman. I'm a carer. I have a grandson who's suffering from a severe disease. Well, when people look at him, it seems that he's normal. He even looks smart. However, if you talk to him for a long time, you will know that he has problems. Well, every day I have to fight with him. He can really talk. So how can we just rely on a doctor's assessment? Well, he's born with this disease. He will never be cured. And every 2 years, he has to be assessed. He talks really well, and he can come up with smart ideas. On the past Sunday, there was a parade for PWDs. He used my octopus and used all the money to buy food, and then he told somebody else that he didn't have money to go home, and that person gave him $100, and he said that he didn't borrow money from that person. The person just gave him money. So for kids suffering from Prader-Willi syndrome, it's not that they don't know anything. I even think they may be cunning, and some people think they are smart. And every night I have to fight with him. It's really difficult for me. I have to do a lot of work. And I have to follow up on his diet. Now, even he has stolen snacks, he doesn't feel that he has eaten. You have to feed him with 3 meals a day. It's not that we are greedy, but for renewing the DA is really difficult, and sometimes it does a blow to our dignity. So please return our dignity to us. Thank you. I do not want to go on anymore. Now someone has finally said that they need dignity. Mr. Tong Hock Leung, New People's Party. I am New People's Party Shatin District Councillor. So for the new MAF, we have heard the views of many deputations and representatives. We hope that the government would respond to their views. Now the government is making some recommendations. I hope that they can be implemented as soon as possible so that doctors and social workers can make assessments more accurately. And for the MAF, some people think that it shouldn't be revised like this because as a result, DA recipients number may drop. I hope the government will take their views into account and try to allay the concerns of these people by taking appropriate measures. Now, under the CSFA systems, elderly people and severely disabled people can enjoy free dental service, and some others can get dental service under the CCF. However, for DA recipients, they cannot receive dental services through this channel. It's very unfair to DA recipients. So I urge the government to look into this. Dental services should be subsidized for DA recipients. And also our party hopes that the government can follow on this. That is, now under the CCF, there is a pilot scheme for subsidizing people with transport allowance. I hope that this can be reviewed and disabled people can be included. You should try to understand the needs of PWDs thoroughly so that a more comprehensive PWD policy can be formulated. Thank you. Mr. Tong. I think that some studies have been conducted. I just don't know if the government will adopt them. It's not that there are no researches or data. It's just whether the government would accept them. Next, Mr. Yu Kam-chong. Thank you, Chairman. I have 10 papers here, but I don't think I can read through them. I'll just read some of them, and I hope that you can read my submission. I hope that there can be a policy or a system so that the calculation of DA can be the same as old age allowance. So for different ways of calculating allowances, I think you should revisit them so that the calculation methods can be aligned. Now for PWDs, if the number goes up, then the DA rate will go down. And also well, for our $1,600, there's no means test, but what can that amount of money be done for? A singleton is $47,000, and for a two-person household is $70,000. And there are a lot of considerations. If we have done something, maybe a certain amount of allowance will be deducted. A lot of professionals agree that for certain kind of diseases, they cannot be cured, and we do not choose to be PWDs. We cannot choose our diseases. Sometimes I think that, well, how come in Hong Kong there are male and female toilets, but when I go to other countries, sometimes they have mixed toilets? Some ladies told me that if the toilets are not divided into male or female toilets, then they don't have to wait for such a long time. So I think there are different ways of handling things, and even for in certain countries, motorcyclists do not have to wear helmets. So under different cultures, there are different ways of doing things. Well, a lot of people would know that many PWDs may not grow to a very old age, and we may not be able to enjoy elderly benefits. Even we have paid taxes. For example, my mother has been paying tax for many years, but she has never received any welfare. And for our rehabilitation equipment, they are very expensive. And even for my electrical wheelchair, is very expensive. Next, Mr. Chen Kai. Today, I would like to talk about DA. Well, DA is to assist severely disabled people so that they can buy the medical equipment, etc. It has been in place for 40 years, but not a review has been conducted, and there has not been any major rate increase. So you just follow the inflation rates. It's just 2% or 3% increase each time. Is really too little, and up to now it's only $1,600. I think it's pathetic. If you look at today's spending power and look at today's society, I think this rate is totally divorced from reality. With that amount of money, you can't buy many things. So I hope that the government would listen to us. Now, for the present $1,600 of DA, it should be raised to $2,500. In 2009, OH allowance was increased from $700 to $1,000. The increased rate was over 60%. But for DA, it has never been increased in such a way. Some legislators accuse the government of being indifferent to the elderly, and $700 were not enough. So as a result, it was significantly raised to $1,000.
Currently, for the DA, since no legislators spoke up for us, or that the government simply did not listen, today I'd like to urge the government to listen. DA is very important for every PWD, especially those who are not receiving CSSA. For PWDs not receiving CSSA, we do not have a lot of them. Well, we have very few of them indeed. They rely on support from their families, and they are living very basic lives. the DA is crucial for the living expenses of PWDs. So I hope the government would raise the DA given the rising expenses. These people feel helpless and they cannot make purchases, and they have to save up for 3 years in DA before they can buy a wheelchair, and they still have to buy urine bags and tubes. So hopefully the government can review the situation and provide another layer of allowance for PWDs. This way they can benefit. Thank you very much. You requested an increase of the normal DA from 1,600 to 2,500. I think you should make yourself heard to the government. Thank you very much. Mr. Yan Shun Kit from the Muscular Atrophy Concern Group. I have attended open hearings for the third or fourth time. I'm a muscular atrophy patient. And I suffer from sclerosis. And the expenditure on consumables is rising. And right now I'm receiving higher DA. I'm receiving about $3,000. So how should we spend the $3,000? Should we spend it on food or consumables? I have to spend almost $5,000 on consumables. Can you come up with a rate for the severely disabled at about $5,000? We feel helpless at the moment because I only take 1 meal a day. While I basically just drink water to fill my stomach. You have been talking about improvement all the time. From what I've heard from other deputations, well, to be frank, doctors are extremely busy. My DA payment once went down from $3,000 to just $1,000, and I was very depressed at the time, and I wanted to commit suicide. So who would pity my situation? I had to face the four walls every day, and I cried all the time. But no one would pity people like me, of course not the government. I once went to work and I was once a taxpayer. So where did the money go? Is it used for properties? The properties can help people in need, indeed. But have you considered the plight of or the needs of PWDs? No disrespect to people in public housing, but the PWDs are only asking for a higher amount under the DA or to offer more help from doctors. Thank you. Thank you. You said you only take 1 meal a day and you have to drink more water to fill up your stomach. Yes, I just need something to fill my stomach. There's nothing else we can do. How long has this type of life lasted? Almost 10 years. I was paralyzed since 2005. Sometimes I drink water or green tea, and I use that to fill up my stomach. So I would only eat a single meal at night. Now I cannot cook anymore, and even my left hand is paralyzed, and I need a surgery. I beg the government not to, to really help us and to help the PWDs. I think improving the DA should not be based on compassion. There are more reasons for that. Mr. Yip Kin Keung from the Fourth Right Caucus. On the 3rd of May last year, we attended an open hearing on the DA. 1 year later, we had to be here again. Last time, Ms. Tam completely distorted the concept of the DA. That's why we need to make ourselves heard again this time. I agree with removing the reference to 100% loss of earning capacity. We hope that no PWD would lose DA because they have to work. And we want to retain Part 1B of the MAF. As Mr. Tam Wai Yip said, without Part 1B, I think Mr. Tam can take care of himself. He can maintain a posture when sitting and standing. I think his communication ability is much better than that of the government officials. Without Part 1B, Mr. Tam will no longer be eligible for DA. So that's why we should retain Part 1B. We should also retain the the criterion of work in the original occupation for certain diseases, for example, muscular sclerosis and Parkinson's disease. After taking medications, they can stand and sit and change clothes for themselves. But they are not sure where when they would suffer an attack, and at that time they cannot work. If we delete the work criterion, they would lose eligibility. The Deputy Secretary said if doctors have difficulty in assessment, then since this criterion is in place in law, employees' compensation ordinance, would the government have to amend all relevant items? Last December, the government said, and only 3 rehabilitative equipment can be exempted, including artificial cochlear hearing aid, etc. For other equipment such as wheelchairs, doctors might say that since you have such rehab aids, your rehab progress would be satisfactory. Some PWDs are hospitalized for a specific period of time, and as such their allowances are slashed, and they're eligible to apply for CCF would be affected, and they would lose $24,000 worth of assistance in a year. We have come up with our own medical assessment form, which is listed in our assessment, and for the HA's doctors, for the NGO version of the MAF, I think you should show it to the doctors, because that is a lot better than the government's form. All right, thank you. I'd like to remind members that this NGO version of the MEF has been included in the submission. Ms. Wong Kim Pan from HKU. A carer asks for dignity from the government, and that left an impression on me. I think the government themselves have no dignity. I came here 4 years ago to talk about DA, and at that time, I still believed that the government would reform the DA system. I talked about examples in Taiwan, UK, and the UN in the definition of disability. To this day, the government is still very unprofessional in when they seek to review the form. The reference to 100% loss of earning capacity is a joke, and the review of the form is even worse. I don't know who decided on those changes. I don't know which government official here would be responsible. They came up with unreasonable criteria, drawn up without any equipment. How can you ask the doctors to assess their communication ability or whether they can take a shower for themselves? I think that the doctors should refuse to conduct such assessments because they fall outside of their profession. Why are these conditions removed? You should just remove Part 1B of the MAF. You are using this one-size-fits-all form for everyone. This is impossible. This form represents an unfair system. There must be an assessment guideline and an open platform. We are talking about public money, and doctors do not know about those diseases. Why is this so unreasonable? 4 years ago, I came up with something more reasonable. If you say that ICF is too complicated, what about the PAP in UK? They use 11 questions to ascertain the level of care required for patients. Assessments would be done by doctors, and the daily living ability might be assessed by occupational therapists. The PWDs care about DA because they cannot enjoy anything else. For healthcare equipment, support, care homes, community care, there's a lack of support. With other forms of support, we have to look at the policy from a holistic manner. Thank you very much.
Next, Mr. C.Y. Sun. Well, for Hong Kong people, I think the government should provide them with resources. So for the patients, do you just want them to die? We were born and raised here, so the government should give us resources. And without resources, people die. So what should be done? Even the mainland has a 3-tier system. And for the severely disabled people, they can enjoy transport for free. In Hong Kong, you still have to charge them $2. Next, Ms. Chen Yin, Hong Kong Parkinson's Disease Society. First of all, the 100% loss of earning capacity reference must be removed. And I hope that the government would accept the form put together by the NGO. This is a clearer and more straightforward form. We hope that this form can help the doctors by saving their time. Parkinson's disease is a chronic disease And for patients with this disease, we would lose our speech ability, our mobile ability gradually. For Parkinson's patients, in a few years' time, we would be reduced to babies. We even have to learn to walk again. And when we speak, eat, there are problems. We would have to learn all these skills anew. If you look at me, I can still talk to you because I have taken medicine. I have to take medicine punctually. But I don't know when the effect of the medicine will stop suddenly. Well, sometimes when I cross the road, the medicine's effect may stop suddenly. Even if we have done operation in our brain, if we put a pacer there, there may still be problems. You may not see our disability on the surface, but we are still disabled. Why can't we have fair treatment? 4 years ago, I was here for the first time, and such views have already been expressed. However, in the past few years, we still have a lot of problems. For Parkinson's disease patients, sometimes they can get DA, sometimes they cannot. And the doctors will say that, I'll only give it to you this time, no next time. Well, we are not asking for alms. We really have a very serious problem. We are the invisible PWD. We also have dignity. We do not want pity or sympathy. We just want to be treated fairly. If we are curable, we do not need DA. We also want fairness in society. For Parkinson's patients, we cannot accept we cannot process two things at the same time. Well, sometimes I use my disability card to take the MTL, and suddenly a MTL staff member would dash out and say that, Madam, now I catch you. Show me your certificate. But I cannot respond immediately. Now, if you have a disability, if you use a card for PWD, there must be reasons. So I hope that people would understand. Now, invisible disability is also a disability. They also need fair treatment. I hope the government would respond to them. I hope the government would respond to that NGO FAM. I particularly hope that the HA and SWT will respond to that. Mr. Lee Chi-yong, first of all, I would like to thank the Secretariat. Well, we handed in our submissions late and they had a hard time. I was here last year and I have to repeat what I said last year. First, for the higher DA, is not enough for the severely disabled people. And also for the PWDs who live in institutions, their rates will be reduced. And if DA recipients are hospitalized for a long time, their DA will be reduced. And for those who are under the age of 12, they may not be able to enjoy certain benefits, and I don't understand why for the severely mentally handicapped they have to renew their DA from time to time. Now, more than 3 years have been spent on this review, and the report is as thick as 200 pages. However, you haven't really looked at the effect of the present system. The government suggests that the MAF be revised, including removing the 100% loss of earning capacity, the work-related criterion, etc. And also, you would delete Part 1B. As for the removal of 100 loss of earning capacity, we totally agree. However, the two other criteria, they should not be removed. We suggest that another tier of DA be given, that is for PWDs with extra needs. For those who are severely disabled, you should look at the level of severity and also try to find out whether there is a long-term need for others to help them. And also for hospitalization, I hope that the exemption period can be increased to 180 days. And also for working in the original occupation and performing any other kind of work, that criterion should be retained. 100% loss of earning capacity reference should be removed. Lately, in the policy address briefing, I've heard from the LWB. I talked to them and I said that if there are other policies that are better than DA, yes, DA may not be the best solution. However, at the moment, we do not have any other measures helping PWDs, so we only have DA. Mr. Yang Ka-Keng. Now for the review of DA, well, we have been talking about that for a long time. We also have had many meetings with the government. The government has also responded to some of our concerns. It said that Part 1B will not be removed and the past practice will be kept. However, it has now come up with totally different recommendations. And there are now a new MAF. If the government does that, is not doing what it promised us to do. As for mentally handicapped people and autistic people, they cannot be cured. Why do you have to assess them regularly? As you do it once in 1 year, 3 years, or 5 years, but they will not improve. If they can really be cured, please tell us. We have been talking to the government many times about this. SWD and HA both think that there is no actual need for such an assessment, and the relevant resources should be put to better uses and spent on more needy people. These two departments have the same view. So for the mentally handicapped people and autistic people assessment, they should be removed. Now, because when they were children, they have already been diagnosed with such problems. So no more tests or assessments should be conducted. Otherwise, you would give us extra psychological pressure, and it's also a waste of social resources. After an assessment, the DA rates may be reduced or may even be taken away. So I think this is totally unnecessary. As for the removal of Part 1B, it is totally unreasonable. DA can only provide for the basic needs of these people, so you shouldn't be deprive them of such an assistance. Well, government officials, you spend so much time and resources on the assessment, but you give people an impression that you are too harsh. You are just trying to give us as many obstacles as possible. So please try to make improvement. Thank you, Mr. Yang. Next, Madam Lam Sin Man. Government officials, I have a question for you. Have you ever been hungry? Have you not eaten 10 meals or 8 meals continuously? Do you know what hunger is like? Now, Hong Kong is such a prosperous society, and our forefathers have been working so hard for Hong Kong. But now they are forced to be hungry. For PWDs and elderly people, they may face the same situation and same pressure. Why do they have to be confined to 4 walls? Because they do not have extra money for them to spend. Even if you give them that $2 concessionary rate, where can they go? How much are you helping them? A conscientious government shouldn't be treating people like this, and in particular, these people have worked so hard for our city. Now they may have suffered from injury. They may be suffering from diseases. This is not what they want. Why is our government so cold-hearted? You just work in accordance with figures. People should not only rely on the government, but what if you don't have anything left? You can only rely on the government. But the government is so calculated. It's so mean. Well, why don't you talk to the big corporations about money? They are making a lot of profits, and the government has so many resources. Why don't you help those who are really in need? Why is our society like this? Why do you just favor the rich and powerful, and you turn a blind eye to the vulnerable? Where is humanity? Do you have no feeling at all? When you are too hungry, you would eat less and less. You would lose your feeling. Thank you. Next, Madam Ho Bo-ching.
Thank you. I'd like to talk about the MAF. I think we should indeed remove the reference to 100% loss of earning capacity, but we should retain Part 1B so that doctors can tick boxes more easily. And in the checklist, there's a criterion: work in the original occupation and perform any other kind of work for which he or she is suited. I think this criterion should also be retained. I talked about DA in 2005. At the time, I talked about hospitalized and children in care homes, and if they stay more than 69 days, they would receive normal DA instead of higher DA. A lot of children receive surgeries, and they often had to stay a long time. I do not understand the logic. Some parents decided to beg the doctor to discharge their children within around 20 days. And 12 years on, you still set a threshold at 29 days. And after that, you would switch from high DA to normal DA. This is infuriating. A lot of forms of financial assistance are related to the CCF. One of my friends stayed about 30 days in hospital, and my friend received lower DA, and she received an extension form for the CCF assistance, and this March you said that my friend would not be eligible because when my friend was in hospital, she wasn't a higher DA recipient. This is ridiculous. The SWD should look at the real cases and you would know what is unreasonable. Criticisms are meaningless. You have to do something. If you solve the problem, we wouldn't receive so many calls. They called the CCF office, and the reply was they can apply 2 years later. I looked at the application guidelines, and they can make applications again if they are higher DA recipients in October 2018. The CCF staff told my friend that on the 31st of July last year, my friend was not a higher DA recipient. As such, she would not be eligible in 2 years. She only paid $3,000. She paid $3,000 for the hospitalization. So a lot of special school only provide boarding from Monday to Friday, and students have to go home on Friday, and they only stay 190 days in school. But again, you are switching them from high DA to normal DA. You need a special assessment mechanism for special school boarders. Chairman, sorry if I've spoken too long, but I need to continue what I said more than 10 years ago. I hope the government would really listen and try to understand these cases to see whether they are reasonable. You wrote the guidelines, but the parents made inquiries, and the reply was that they would be eligible after October 2018. These deductions are very cruel for DA recipients who are not on CSSA, because we have to rely on DA. I think for details you can refer to my submission. Thank you. You spoke for an extra 2 minutes, and I hope you will never have to speak on that again later. I'm Ms. Lai Ka-man from DAB. The government should take care of CSSA and DA recipients. The current level of DA was first introduced in 1973, and it has been outdated. The government must make changes. The DAB feels that the government should review the DA system as well as reforms. The purpose of DA is to help the severely disabled to meet their special needs. And when drawing up the threshold, the government should not be too harsh. Otherwise, the disadvantaged groups would feel even more helpless. That's why we have a few suggestions. First of all, the current MAF is very complicated. except for experienced or specialist doctors. Other doctors cannot come up with accurate assessments within a short time, and this form is extremely important. It would affect the eligibility of the applicants. We suggest setting up an assessment group to carry out holistic assessment. Assessments must be objective and accurate, and we suggest getting primary doctors, occupational therapists, social workers, and professionals on board in this group so that they can gauge the impacts on daily lives of the PWDs. Despite their handicaps, PWDs can still contribute to the society. So apart from financial assistance, the government should also offer policy support. We suggest the government to set up a PWD employment places program, and you should require corporations to hire a specific percentage of PWDs, and the expenses of PWDs should be tax rebatable so that they can achieve independence. And DAB feels that the PWDs should be able to receive fruit money because the two types of assistance are different in nature. The first type is for PWDs, the second for elderly. We do not agree with the view that this is a case of double benefits. We hope the government can adopt our suggestions so that our PWDs can live more dignified lives. Thank you very much, DAB. Thank you. And finally, Ms. Chang Kwok Chun from the Preschool Mental Handicap Parents Association. Good morning. I'm the last to speak. So I might be repeating what others have said. We have read the government's paper issued on the 13th of March, and in Appendix 3, they suggest removing the reference to 100% loss of earning capacity, and we agree. And we have three suggestions. One is for chronic hospitalized patients, and the DA payments would be switched from higher to normal. DA is currently linked to the CCF subsidy. For once the DA is switched to normal, then applicants can no longer apply for other forms of subsidy. The government should not link DA with the CCF. Even with a lower DA, they still have to pay medical and hospital costs, and parents would find it even harder because they have to take care of their children in hospital every day. For those on higher DA, they require more care. But hospitals do not have so much manpower, so the parents still have to help take shower for them. So this is not really reasonable. So docking the special care subsidy is also unreasonable. I want to talk about students boarding in special schools on higher DA. Schools would often ask students to go home if they are sick. And students have at least 90 days of holiday every year. So during those 90 days, should you offer higher DA? So we suggest paying 3 months of higher DA to those families. I'd like to talk about Part 1B as well. and mentally handicapped persons are excluded. They are also, even though they are also PWDs. If you remove that condition from the assessment, so apparently they are not 100% handicapped anymore, and they have to rely on doctors' assessments. However, doctors do not know the patients very well. Their communication and performance would affect doctors' assessments. That's why we suggest the government to keep Part 1B. So that people who would have been eligible for DA would lose their eligibility. Thank you very much. This open hearing is intended as a response to the meeting on the 13th of March. And, but some deputations said they have talked about it 2 years or 12 years ago. And back in 1973, there were potential issues already. But over the years, these problems have still existed. I doubt why the government fails to improve upon itself. The meeting will last till 11:30. We have enough time for members and government officials. Members who have questions, please indicate to us. Right now we have Mr. Leung Yiu-chung, Dr. Kwok, Fernando Chang, and Mr. Roy Kwong, and Dr. Lau Siu-lai. 4 minutes each. Mr. Leung Yiu-chung, please. Thank you. I'd like to thank the deputations for offering their views today. And the scope of discussion has gone beyond what the government has covered. Can the Secretariat summarize the views of deputations in the table, and you can then submit it to the government for a response? Then we can see what they can do within a short time and what cannot be done. Can they come up with a with this summary so we know the government's stance? Can the Secretariat do that? We hope that the government won't wait until after the 1st of July, and hopefully they can offer a response before that within the current term government. So after the 1st of July, we can state our request to the next term government. Would the chairman allow that? Thank you very much. I shared a motion with the chairman. I hope that it can be passed this time. I'd like to explain my motion. I could not include everything covered, but I only highlighted some key points and those with consensus. I request the government strongly to improve the policy support to PWDs, including the MAF. You should remove the reference to 100% loss of earning capacity, and you should retain the criterion of work in the original occupation and perform any other kind of work. And 3, you should retain the conditions under Part 1B and expand its scope. And we hope you can also include other conditions in your scope.
Secondly, DA should be made independent. It should not be packed with other social security allowances. Because you really have to respect the genuine needs of the PWD, so the DA should be made independent. And thirdly, review the DA system, the whole system, and raise the DA rate because it is really too low now. What can you do with $1,000 odd? Well, they need equipment and all sorts of services. So $1,000+ are not enough. Even the higher DA is not enough. I hope the rates can be increased so that the PWD's living quality can be improved. This is my motion. Well, I am referring to my motion now because I want to incorporate your views, and I also hope that the Secretariat can provide the relevant information to the government. Now, I would like to ask the government this about my points 2 and 3. That is whether the DA system, can it be made independent? And third, whether you review the whole DA system so that the DA rates can be increased. Mr. Donald Chan. With regard to point 2, for DA, whether it should be independent and be made and can be delinked from other welfare subsidies, for example, CSSA. The government's position is like this. Now, take CSSA as an example. Now, if a person applies for CSSA and if he has disability, then the CSSA system would have already taken his disability into account, and a higher rate of CSSA would be granted. Now, if he needs a helper or he needs long-term care, then under the CSSA, subsidies will be provided. So that's why we think that DA and CSSA should not be independent from each other. This is the government's position. But will you review that? The reason is that for our other systems, for example, CSSA system, that need has already been taken into account and the rate would already reflect that. So on top of CSSA, he should not be able to get DA. And for the third point, last year we came here to a report and we said that the working group has already given its views concerning the rates. Now, for DA, it's not contributory and it's non-means tested. Earlier on, we had a consultancy study, and in other countries, for other countries, their system is not like this. Either they would have a means test or the system is contributory. So I think we should be more prudent, and we are not proposing to increase the rate, but we will try to strengthen our help in other aspects. Now, I would like to talk about the MAF. Now, for the forms amendment, we are not trying to tighten the eligibility criteria. Well, there may be things that are unclear in the form, so we are now trying to clarify them. Well, you want us to remove the reference to 100% loss of earning capacity. As for the criterion, the work-related criterion and Part 1B, we've heard your views. And we will go back to talk to the HA doctors. Now, we want the form's original intention to be clear, and also we also want to address your concerns. We'll try to see if the types of disabilities can be kept, and also for the work-related criterion, we would also revisit that. But I would like to reiterate, we are not intending to tighten the existing eligibility criteria for the DA. And I would also like to make some other points. Just now, You've talked about a fundamental problem. That is the classification or the types of disabilities and ICF. Many of you talked about the international classification of functioning. Since the last review, we have looked at that. For ICF, it is not a system that can be used to make a direct classification, but it's a very elaborated classification system. We understand that the world's trend is like this. That is, it's not only focusing on DA. Policies should be looking at the functions of PWDs, but not the severity of the disability or the type of disability. We have asked the Rehabilitation Advisory Committee to look at this, but not many countries or regions have adopted ICF. Only Taiwan implements ICF comprehensively, and it will be rolling it out in full next year. So we will be monitoring closely so that we can come up with a better definition for disability, and we can put together a better system to assist the PWDs. And maybe my answer can end here, and then I would like to answer other members' questions. I believe many members would have questions. Dr. Kokaki, first of all, I would like to thank the deputations for coming here. I've heard Mr. Chen, he says that he would look at the second and third parts. I hope the deputations will follow up on this. But I would like to share my personal experience with you. Over 30 years ago, when I was a junior doctor, I was also asked to do medical assessments. After 30 years, there has not been much change. Now, for DA, why are there so many problems? Because for all the problems that cannot be resolved, the government will put it under the DA system, and it has asked the doctors to do something that they should not be doing. Now, for the needs of the PWDs, no matter whether it's resources or services, you shouldn't just rely on doctors. There must be a stringent mechanism. Now, we need experienced doctors, psychologists, social workers, therapists, etc. But Hong Kong is so backward, and you should not put this responsibility on the hospital authority. You know that the doctors are very busy. They can only spend 5 minutes on each patient, and now you are asking them to do this medical assessment. I think the government is shirking its responsibility. And also for DA, many patients would have to rely on it. I can cite some examples. Well, for those who have undergone ostomy, they need to buy their medical consumables, and they have to rely on DA. Now, for the government, it hasn't really looked at the needs of different PWDs, so it's just put all these allowances under the DA. So, Mr. Chen, will the government review its way of doing things, that is comprehensively look at the needs of different PWDs? And for different degrees of disability, and also for people with mental disability, they may have different needs. So there are different levels. You cannot just sweep everything under the carpet. The government's answer is ridiculous. It's just for its administrative convenience. And also for the HA, I don't know whether there have been changes. Has the government given support in the following areas? For example, trainings, financial support, training courses, etc. Now, for doctors who have to carry out medical assessment, have they received the relevant training? Do they need to be specialists, etc.? Deputy Secretary, thank you for Mr. Kwok's question. Now, for the DA, now the criteria are quite simple, and you think we just totally rely on doctors. Well, administratively, well, the DA rates can be from $1,000 to $3,000. Now, if we have a huge team doing that, maybe it's not proportionate. And also for the eligibility criteria, should we be taking more factors into account? We talked to the consultants, and we know that there are a lot of views. Now, for supporting the PWDs, maybe we should have a more sophisticated classification so that we would know the different needs of different people. But this is not about the review of DA. Maybe the Rehabilitation Advisory Committee can look at ICF and come up with a more comprehensive plan. HA, can you also answer the question? Now, for the DA system, yes, it's a historical heritage. Just now, the member has also said this. Well, for HA doctors, they are mainly to save people's lives. So now, in the present system, the doctor would assess the PWDs in accordance with the MAF. As for training, in the past year or so, we hope that we could enhance doctors' knowledge in this area, so we put together some guidelines and case scenarios. And we ask doctors to use them as reference. And also, we will provide doctors with trainings when they first joined us. In certain specialty, we would ask senior doctors to be coordinators. So for junior doctors, if they have questions, they can always go to such senior doctors. So internally in the HA, we hope that the consistency can be improved. How about years of experience? It is very difficult for us to set limitations in that area. Now, there are hundreds of thousands of cases each year, so it's very difficult for us to ask only senior doctors to do that. Does the HA provide any support? We do not provide any extra support. I hope what she said can be given to me in writing. She talked about hundreds of thousands of cases. Well, I hope that justice can be done to the HA. I think now they have to shoulder the responsibility for the government.
We can provide the information if available. In your 4 minutes of speaking time, please allow some time for the government to respond. We have a few members waiting to speak. Dr. Fernando Chang. Thank you. I'd like to once again thank the deputations for being here. We have been discussing this for a lot of times. And about 140,000 people are receiving DA. According to the government's Census and Statistics Department, we have about 600 to 700 PWDs. In other words, most PWDs cannot receive DA. And DA is for the severely disabled, according to the government. And in our assessment system, the biggest system down the years is why we have to link DA to workability. And in 2009, the Ombudsman made an investigation recommending a deletion of this condition, and the government also agreed. Apart from removing the reference to 100% loss of earning capacity, you also want to remove the 6 conditions under Part 1B, including mental retardation, etc. According to information in the past, DA recipients with one of these conditions make up about 1/3 of all recipients. So if you remove these 6 conditions, the 1/3 of the recipients might no longer be eligible. That's why we strongly object to removing these 6 conditions. The Deputy Secretary said they would consider it, and we do welcome that. But I hope that you would really look into the issue. I don't know if you have any figures on hand. If you do, perhaps you can give us an answer. How many PWDs do we have fulfilling any of those 6 conditions? That won't be a small sum. Another point of argument is on the deletion of the work criterion. Apparently, it sounds logical, because if the level of impairment is not related to work, you can remove that. But as some deputations have said, their levels of disability might not fulfill your other 3 conditions. For example, mobility or general descriptions. But since they cannot work in the original occupation, they would be eligible. If you delete that criterion, they might be made ineligible. The government said they have no intention to tighten the eligibility. If this is the case, the retention of this criterion would not affect the assessment. So I hope you can consider that. If we link the DA to the CCF, why are you depriving patients who are hospitalized for a long time from a higher DA? Why are you making such deductions? And for boarders in special schools, they stay home 40% of the time. Anything in response? On the form, I reiterate that we have no intention to tighten the requirements. Removing the 6 conditions do not mean that those suffering those conditions would be ineligible. Our intention is to clarify certain ambiguities on the form, but with these concerns, we would revisit the situation and see how we can reinstate those 6 conditions and how we can retain the work-related criterion. Of course, we have to consult the doctors. As to the final comment from Dr. Chang related to the CCF, perhaps I would invite the Deputy Director, Ms. Lee. We have to look at the policy intention. The higher DA was introduced in 1988 and it was approved by LegCo. it served to provide extra assistance to PWDs. So at that time, a double payment was introduced. That's why we had the higher DA. If PWDs were hospitalized for more than 29 days, or if they are boarders in special schools, they would not be eligible for higher DA. But we realized that some PWDs who are hospitalized might have to pay various expenses. So we would try to help them through other ways, for example, by providing waivers and concessions. So we would look at the holistic or the entire system. My point is they are only temporarily hospitalized, for example, for a month or so, or even or 1 or 2 months, and they would no longer be eligible for the CCF subsidy. That's what Ho Bo Ching said, but you were not addressing my question. The policy intention in 1988 was that the PWDs must stay at home. I've not heard this view, so can you provide more information on this? We just received the submission from Ms. Ho, and she also talked about that case. And she was not eligible for higher DA, so I want to look into that case with Ms. Ho afterwards. And I want to see if she was prevented from receiving the CCF subsidy. You wrote those guidelines. Those were in the guidelines. I think you are not familiar with the guidelines. I went to the website and read it. After being discharged from hospital, and if you are eligible for higher DA by the end of October 2018, then you would still be eligible for the CCF subsidy. So can you follow up on that with them afterwards? Apparently, Ms. Lee is very familiar with the regulations, so perhaps you can talk to her later. Before Mr. Roy Kwong speaks, I want to extend the meeting by 15 minutes. Since everyone is here, if Mr. Kwong doesn't mind, can we deal with Mr. Leung Yiu-chung's motion first? Thank you very much. Mr. Leung Yiu-chung, you have introduced your motion. Would you read it out again? I think there's no need to waste time. All right, so we would show his motion on the screen. Mrs. Regina Yip is just here, so I would read it out. The panel strongly requests the government to improve the policy support for PWDs as soon as possible, including for the medical assessment form, or MAF, deleting the reference to 100% loss of earning capacity, and 2, retaining the criterion of work in the original occupation and perform any other kind of work for which he or she is suited. 3, retaining the conditions under Part 1B of the MAF and expanding its scope. 2, the DA should be independent and should not be linked to other welfare items. And 3, reviewing the DA system and raising the allowance levels to improve the lives of PWDs. Thank you. All right, so everyone's clear about the motion. Let's proceed to the vote. Those in favor of the motion, please raise your hands. So the decision seems to be unanimous, so it's unanimously passed. Mr. Roy Kwong, thank you. First of all, the government should not be so mean. for DA recipients who are hospitalized, their allowance might go from higher to normal to nothing. Hospitalization is not a kind of benefit. They should not be, the recipients should not be deprived of their allowance because they are admitted to hospital. And the DA system must be substantially improved. For example, the appeals period is very long. It's up to a year, and they receive nothing during this time. So shouldn't the government address that? Sometimes you cannot blame the complaints or people making complaints. The normal DA rate is 1,600, and higher DA is about 33,000 or 3.3 thousand, and you should help the DA recipients and the CSSA recipients. If the government has no money, we wouldn't blame you, but you are spending $200 million to celebrate the anniversary of the handover. We are just talking about $3,000 every month for PWDs to restore their dignity. Ms. Lam Chen, thank you for offering your views. And she is really helpless. Are we going to wait for something to happen before the government will act? Last year, the Bridge of Rehabilitation incident, it was well publicized, and there were petitions, and the government said they would carry out a reform, and they committed to canceling the exemptions for private homes, etc. Do we have to wait for something to happen before the government would do something for PWDs? Would PWDs no longer receive DA after being hospitalized? I called the hotline 1823 for PWDs who are hospitalized for at least 29 days. They would receive normal DA instead of higher. Can the government confirm that? I'd like to, well, thank you very much. First, that was the design. When higher DA was introduced, we considered the severe disability of PWDs and that they required constant care, and it imposed a heavy burden on their families. That's why higher DA was granted. If the PWD is admitted to hospital and is under care in the hospital, the decision at that time was, since the PWD was already in the hospital, there was no reason to offer higher DA anymore. Considering the need for a grace period for hospitalizations not exceeding 29 days, then care would still be needed by their families. So PWDs can still receive higher DA if they are hospitalized for less than 29 days.
So it seems that you are so kind. You've been offering them a lot. Don't stay in the hospital for more than 29 days, right? So shouldn't you review this part? Is hospitalization a welfare? If this is a welfare, you shouldn't be offering them extra welfare, right? As I said just now, for higher DA, the original intention is that because the parents or the family have to take care of the PWD all the time. But if the PWD is in hospital, it's different. Well, for higher DA, it's only $3,300. That's not a lot of money. So for 29 days, would you review this? Now, for DA, we calculate on a monthly basis. So if a PWD is hospitalized, can you not reduce the higher DA? Well, if a PWD is in hospital for not more than 29 days, then higher DA would still be given. But if the PWD is hospitalized for 2 or 3 months, well, then he's still a PWD. Well, but under such circumstances, the higher DA does not apply. We still have 3 members who would like to ask questions. First, Ms. Lau Siulai. Chairman, thank you. I have a lot of things to say. Originally, I didn't mean to say anything. But just now we've been talking about the 29 days hospitalization. I think the government officials are making an assumption. That is, after a PWD is hospitalized, he does not need a high degree of care from his family. So for the 29 days is a grace period. So that's the premise here. When a person is hospitalized, you do not need intense care from your family. But this is wrong. You assume that the hospital takes very good care of patients. I do not want to blame frontline healthcare workers. They do not have enough resources, so they cannot take care of patients very carefully. So that's why family members are very worried. They have to visit the hospitalized PWD all the time. I had that experience with my mother. Now, if I don't visit my mom, the staff would just give her 3 minutes bath. But if we visit my mom, then the nurse would give her a 15 minutes bath. If we visit her, people would feed her meals while the meal is hot. If we do not visit her, then she wouldn't be fed so quickly. So we really have to pay attention to our family who are hospitalized. They are not treated that well by hospitals. So I think your premise is wrong. And secondly, it's also absurd. Some PWDs said that for permanent PWDs, when they apply for DA, where they have to renew it. Now, you just offer them DA for a certain period of time, and then they have to be assessed by a doctor again. So for PWDs who are suffering permanent disabilities, this is really a lot of trouble. Can you abolish this absurd system? And that's another point. Mr. Chen says that they would review. Now they are proposing to remove the reference to 100% loss of earning capacity. You will do that, and we are glad. And I understand that you are not tightening your policy, but for frontline healthcare staff, they have to be very empathetic. Then they would find out the hidden problems of the PWDs, and they will agree to apply for DA for them. However, I've heard a lot of views. Doctors are not that empathetic. In particular, if they just assess the patient for a short period of time, they may not find out hidden problems of the patient. So as a result, not many DA application cases have been successful. For example, there's a patient with a hip bone problem. It's very difficult for him to sit. The doctor knows that, but he does not trust the patient. Now, the patient demonstrates that he cannot move properly, but no matter what, the DA was not granted to him. So we need frontline medical staff to be empathetic. I'm not trying to criticize them, but some doctors are like that. So the forms have to be in great details so that the doctors would know that they really have to look more thoroughly. So I agree with Mr. Leung Yiu-chung. The assessment criterion of working in the original occupation and performing any other kind of work for which he or she is suited should be kept, and types of disability in Part 1B should also be retained. Mr. Ray Chan, I would like to thank the deputations for coming here today. I've heard a lot of cases. I don't think we can deal with the cases one by one now. After the meeting, if the administration is willing, I hope that the deputation's problems can be followed up on. Just now, you talked about the appeal mechanism. What is the appeal mechanism like now? Is there a time limit, 1 year or what? Dr. Chen Pu-yin did ask such a question. That is, in the past 5 years, how many DA applications have been made and how many appeals have been lodged? This morning, I asked Dr. Chen whether he got an answer. He shook his head. In 15 to 20, there were 43 appeal cases. How many of them were about DA, and what were the outcomes? If there is an appeal mechanism, and if the applicants are aggrieved, they have a channel. So can the administration tell us more about the appeal mechanism? Deputy Director. Yes, for the Social Security Allowance scheme, there is an appeal panel, and the members and chairmen are appointed by the government. This is an independent panel. So for anything involving Social Security, if an applicant is aggrieved, if he's not able to get a DA, or if his higher DA is reduced to normal DA, he can bring his case to the appeal panel. And because this is a medical assessment appeal, so we need doctors to carry out the medical assessment again, because this is an independent committee, and the doctors sitting on it include doctors from the public and private sector. So if there is a case, we will make arrangements for a hearing. We do not want to know what the mechanism is like. We want to know the outcomes. Do they have to wait for 1 year if there is an appeal case? Yes, I know that you are very concerned about the waiting time. So we have some statistics here. In the past, it would take about half a year. Then an appeal can be handled. It's not 12 months. Okay, half a year. Please be quiet. This is not just about DA. So how many cases involve DA? And can you tell us more about the results? I do not have the relevant figures in hand. I can provide them to you after the meeting. Well, have the deputations lodged complaints through this appeal mechanism? Have any of you used the appeal mechanism? How long have you waited for? They have called me. They said that it will take at least half a year. Dr. Chen Pu-yin, I would like to thank the deputations for coming here. Now, when you come to public hearings, you will say that, well, you only have 3 minutes, but for legislators, we have less than 3 minutes. I'm now still a practicing doctor. I feel very depressed because I am forced to spend only 3 minutes on each patient. But here I have less than 3 minutes. I am still signing MAF. I have to sign NAF all the time. I hope that the government would understand this. That is, we doctors are forced to do this. Now, if we do not give an approval, then the government would say that, well, it's the doctor's responsibility. Well, you talk about guideline. I haven't seen the guideline. I haven't taken any courses. I just make my judgments in the capacity of a doctor. Well, some people are afraid that the eligibility criteria will be tightened. Well, it's not tightened, but if we follow all the guidelines, then less approval will be given. Now, doctors tend to be more lenient when they sign MAF. If you look at the government's paper, there is a form. Well, how many people would lose 100% loss of earning capacity? That would include quadriplegia, paraplegia, loss of functions of 2 limbs, total loss of sight, etc. So how many people are eligible if these guidelines are followed stringently? So most of the time, I would tick the box others. I'm actually on your side. I tend to be more lenient. Well, the government also is on the lenient side too. Now, if you want to set up a working group to do the assessments or a panel to do the assessments, if you want to involve therapists and other people, and if the system is made more stringent, you will lose. Doctors tend to be more lenient now. So how can you do everything in 3 minutes and even fill in the form? It is impossible. So we just look at your medical record, we look at your overall condition, and then we will make an assessment as to whether you should be entitled to DA. We are lenient. You have to understand this. But if you force the government too much, then the government follow the guidelines strictly, then you will no longer be able to be eligible for the DA. So don't push too much. Every week, every month, I am filling in the MAF. I have never seen the guidelines. I don't know where the guidelines are. But you have to understand this. Now both doctors and the government tend to be on the lenient side. Thank you. I think representative would like to say something. Now, if the SWD insists on the policy intent, then what is the original intent of the accountability system? If you hire a person, he has to do something. If you cannot solve the problems, then according to the original policy intent, you would penalize the people who are responsible for this. In particular, Matthew Cheung, he's been the Secretary of Labor and Welfare in the past few years, and he has made so many mistakes. And for PWDs, if they are not going up for follow-up consultations, what will happen to the DA?
I don't think the government officials have time to respond. So do you have any other views to express? So 1 minute each, please, because we are out of time. Mr. Chiu. Dr. Chen talked about the form, and for the SM of our specialty, he would stand for the government, and he said all the rules are laid out clearly, and they cannot just casually sign forms. basically the DA would depend on the doctor responsible, and the doctor said they cannot sign it, since that's not allowed under the rules. Ms. Wong, someone talked about CSSA. I live in a care home, and I have to pay the rents using the subsidy. I only have $200 of spare money every month. How can you say that CSSA would cover everything? It does. Why are you saying that CSSA recipients cannot receive other forms of subsidy like DA? If I have no, well, I have no ability, that's why I'm receiving CSSA, but I'm only getting 50%. 95% of the subsidy has been given to my residential home. I only have $200 a month. Next, Mr. Ko Chong. The government said they will review their policy or ordinance, but I have not seen anything. For mentally handicapped, a check is needed every 2 months. The government should not just look at the form. They should look at our real needs. And they should make adjustments based on different levels of disability. Doctors have a very hard time. They have to sign a lot of forms. And we shouldn't make life hard for the doctors. You should make an amendment. Next, Ms. Lam Sin Man. The government should assess our different levels of disability. They should not try to throw us around. We have no one to help us. We want to be self-reliant, but you are not providing any support or subsidy. Hopefully you can help us in different ways. Whether for NGOs and private companies, you should give us more opportunity to live a dignified life and get a dignified job. We don't want to rely on you, but we are powerless because we are being discriminated against. We are given unfair treatment. We do not have equal opportunities. That's why we are forced to live on DA. We don't want any compassion from you. Thank you very much. Thank you very much for the deputations with us today. And I'd like to thank the government officials too. I hope that this is just a review indeed and not a tightening of the requirements. But there are some unintended consequences. And hopefully the government officials would consider the situation. This is not just about the form. It's about the standards or conditions or appeals mechanism. So there's a lot of food for thought. Let's pay attention to the motion which was passed as well. So for other information, please offer more information after the meeting. So we have to end here. Thank you very much.